Hi friends, today we will talk about the right atrium and left atrial hypertrophy of and their electrical presentation on ECG. So let's go through the atrial hypertension. So before going to the atrial hypertrophy, we have to know the normal ECG graph. This is what the normal ECG, and this will show the atrium. That both right and left atrium, so we can say they are showing the atrium. So this P wave is a combination of two components, two chamber of hearts, two chambers. For example, this is what the left and right chamber, right atrium and the left atrium. So this P wave presenting the both depolarization of both chambers. So if we divide this P wave, then according to the depolarization of each compartment, they will show different curves. For example, this will be the depolarization of right atrium, and it will be the depolarization of left atrium. So it will be right atrial depolarization, left atrial depolarization, and this will be the common, that is right atrial and left atrial depolarization. So we can make a combination of these two waves like this. So this shows the both depolarization of the both chambers, left atrium and right atrium. So if any fluctuation in the electrocardiography of the both atriums, then these two waves, they show fluctuations. For example, we will discuss later that how the wave change in right atrial hypertrophy and how this wave changes in left atrial hypertrophy. So normally we have to know that this timing of atrial depolarization is 0.1 second, and this wave is normally seen in lead V1 and lead V2. These are the chest leads. For example, this is your heart, so we can place V1 and V2 on the side of the sternum. For example, this is your sternum. So in the fourth intercostal space, we place V1 and V2. So these are, V1 is nearer to that of the atrium, V2 is nearer to the left atrium. So both can draw a graphical presentation of the depolarization of right and left atrium. So we will prefer the lead V1 and V2 for the examination of the P wave. So let's go through the hypertrophy. So in case of right atrial hypertrophy, it is right atrial hypertrophy. So what will be the changes in right atrial hypertrophy? In this, for example, the right atrium, it undergoes hypertrophy, but the left atrium remain in the normal size. So this undergoes hypertrophy, increasing in muscle size and thickness of the atrium. It undergoes hypertrophy, increase in size, and mainly the reason of this hypertrophy is related to the pulmonary hypertension. The pulmonary hypertension leads to the right ventricular hypertrophy, and this right ventricle exert the pressure on the right atrium, that in order to push the blood from the right atrium to the hypertrophied right ventricle, it have to do more work. Once it have to do more work, it become hypertrophied and increasing in size. So a generation of impulses from here, and these impulse separate over the, you can say, separate to the whole muscle of the right and left atriums. As the left atrium is normally working, so it will not show any changes in its wave, but this right atrium will show some changes because it become thick. So the depolarization in this area will be a high altitude. It will not take much time. Why? I will discuss. For example, as I draw the graphic representation of the atriums like this, and ventricle, right and left atrium like this, they have the same amplitude. This is the P wave. So in case of right atrial hypertrophy, this wave, that is right, which is presenting the right atrium, it will increase in its amplitude, somewhat like this. But the left atrium remains the same. It will not change. It will keep same in this position. So why this the right atrium is only increasing in amplitude? Why it's not taking the increasing the width of the wave, right atrium wave? The reason is that it is nearer to the pacemaker cells. So as it nearer, very close to the pacemaker cell, so it get impulses very rapidly. So the time for the depolarization remains the same, but the amplitude degree will increases. So here we can see that the right atrium, the P wave for the right atrium, it increase in size. So the new wave, it will be like this. Its amplitude increases, but the time same. Amplitude increases, but the time it will keep same, that is 0.1 second. So this amplitude we can see in lead V1 and lead V2. As the lead V1 is closer to the right atrium, it will show a more fluctuation. Here the amplitude will be more than 2.5 millimeter. But in V2, which is little bit far away from the right atrium, it will show some more than 1.5 millimeter. So this is about the right atrial hypertrophy. So we will discuss left atrial hypertrophy, that what will happen in left atrial hypertrophy. So in case of left atrial hypertrophy, the left atrium undergo it is also called as M. pulmonale. So if P is called as P mitral. It is called P mitral, and the right atrial hypertrophy is called as P pulmonale. P pulmonale because the right atrial hypertrophy is mainly due to the pulmonary hypertension. So we are called as P pulmonale. But right atrium, the hypertrophy of right atrium is mainly due to the mitral valve stenosis. Once the mitral valve stenoized, it become smaller and narrowed, then it will be difficult for the atrium to push the blood into the left atrium, so the left atrium it undergoes hypertrophy. For example, this is your right atrium, it will be the left. So once this valve becomes stenized, smaller and stiffened, it have to exert more pressure in order to push the blood from the left atrium to the left ventricle. It have to perform more work, more pressure, more strongly work, so the blood will move into the ventricles. Therefore, it undergoes hypertrophy due to excessive work and the more pressure, it increasing in size. So in this case, we can see that the left atrium undergo hypertrophy, hypertrophied right atrium. So once the right atrium become hypertrophied, the waves, the impulses from here, it will normally separate over the right atrium, and it will go to the left atrium, and it will take a long time to travel the distance of the thick layer of muscles. That's why it is taking too much time. So in P wave we can see a delayed P wave. That in the graph here, for example, this is the normal right atrium, this is what the normal left atrium. So in that case, in hypertrophic case, the amplitude will not change. Amplitude of both remains the same, but the length increases, that it will take now longer time. Like this, it's taking longer time. So the time, the new graph of P wave is like this, little bit bifidus, like this. So we can also like this. So the time now here, time is more than 0.1 second. It also present, that is V1 lead and V2 lead. These two lead we use in order to examine, in order to see the P wave. So here the P wave is also called as bifidus P wave. Bifidus P wave. So this is about the left atrial hypertrophy. This bifidus in increasing length, the amplitude remains the same. Rather in that of the right atrial hypertrophy, we see the amplitude increases, but the length or the duration of the time remains the same. So this is about the right and left atrial hypertrophy.